President Trump signed two executive orders this week on Social Security and Medicare. The questions I keep getting asked is, how are these new policies going to affect your benefits? That is what I'm going to answer today in this video. And if you stay till the end of this video, I am going to show you how you can save $1,100 on your Medicare bills this year. I am Kwame Kwade. I am an entrepreneur and personal finance expert. For 15 years, I've been helping seniors get the retirement benefits they deserve. We started with websites on Social Security, Medicare, Medicaid, food stamps, and now we are adding video content. And I'm also an adjunct professor. I teach finance at one of the most prestigious universities in the United States. If you're new here, hit the like button, hit the subscribe button. We do appreciate your support. And as always, I want to know where you are watching this broadcast from. So do me a favor, go into the comments and let me know your city and your state. But let's get started. What are these new executive orders that President Trump signed this week that is going to have profound changes on both Social Security and Medicare? Let's get to it. So the first one is about Medicare, and this is going to impact your pocket in huge ways. So let's talk about it first. So the high cost of prescription drugs is what the president wanted to address. Americans pay the highest prescription drugs in the world, with costs nearly double those of other developed countries. That's a big deal. In 2023, the US prescription drug spending surpassed $600 billion, straining families and seniors alike. Seniors disproportionately are affected by this issue. Nearly 90% of seniors age 65 plus take at least one prescription drug, and out-of-pocket costs can exceed $4,000 per year for those with chronic conditions. Medicare covers over 65 million Americans, and the drug price hikes directly impact federal spending and, most importantly, the budget of seniors. So the president needed to take action. Addressing high drug prices is a top priority for voters, with 83% of voters supporting the government negotiating lower prices. So, what is this executive order about? President Trump ordered direct Medicare to negotiate prices for more drugs, building on the Inflation Reduction Act signed that achieved a 22% saving in its first year. The number of drugs under negotiation will rise from 10 under the Biden administration to 25 in 2025, targeting high-cost treatments like Ozempic, which is the weight loss drug, and cancer therapies. The goal is to surpass previous savings. So the administration aims to eclipse the $6 billion in projected savings from the Biden administration's first round of savings from those 10 drugs, delivering even greater relief to seniors. The order seeks to align Medicare payments for drugs with hospital acquisition costs. So whatever the hospitals are getting at cost for those drugs are what you are going to get, which can be 35% lower than the current rate that the government pays. Insulin. The executive order revives a program offering insulin to low-income and uninsured patients for as little as 0.03 per vial plus small administrative fee, addressing a critical need for 8.4 million Americans with disabilities. And then there's affordable EpiPen. Injectable EpiPen will be available to qualified patients for $15 compared to retail prices often exceeding $600 per 2-pack. That's a huge, huge savings. And then there's community health centers that are going to play a critical role in this. Federally qualified health centers are now mandated to pass on these savings, expanding access to underserved populations. These measures could save eligible patients hundreds of thousands of dollars annually on life-saving medication. Another thing is facilitation of drug importation. That has been one of the most controversial things because drugs are cheaper in some countries, some developed countries like Canada. And so the order directs the FDA to streamline approval for state importation programs, enabling access to lower cost drugs from Canada. States could save millions annually as Canadian drugs are often, hear this, 50 to 70% lower than in the US. And Florida is a good example of this. Florida achieved FDA approval for drug importation in 2024, setting a precedent for other states to follow. Now, pharmaceutical industries obviously are not happy about this. They are opposing this, citing profit loss and regulatory concern, but public support remains very high. Now, what does this look like? Currently, small molecule drugs, pills, are eligible for Medicare negotiations after 9 years, while biologists, injections, and infusions have to wait 13 years, creating a huge imbalance. The disparity incentivizes companies to focus on biologics, which are more expensive, and delay price cuts for patients. The order instructs the Health and Human Services to work with Congress to equalize negotiation timelines between these two drugs therapies, aiming to encourage innovation without increasing Medicare spending. Aligning timelines could save billions in Medicare costs and increase access to affordable pills for chronic conditions. Another thing the president is directing is streamlining approval for generics and biosimilars. The FDA is directed to streamline the approval process for generic drugs and biosimilars, which are lower cost alternatives to brand name medications. Generics account for 90% of prescription drugs, but only 20% of drug spending. Increased competition could bring down prices even further. And then 40 plus biosimilars approved in 2015, slow uptake has limited savings. The order seeks to boost their use. Quicker access to generics and biosimilars could save patients and healthcare system billions of dollars annually. And then there's the issue of tariffs. How is tariff going to affect all of this? The administration is considering tariffs on important pharmaceuticals and ingredients, which could raise prices and worsen drug shortages if not carefully managed. Medicare negotiated price cuts from Trump's order will take effect in 2027, while savings from importation and generics could come much, much sooner. Some provisions, like changing negotiation timelines, require legislative approval from Congress and may face heavy lobbying. So that is what we all have to pay attention to. The administration pledges to monitor savings and access, aiming for transparency and accountability as reforms roll out. So this is a critical thing. I want to walk you through the president's executive order, what is in it, so that you can see it for yourself. So, what does the president's executive order on Medicare talks about? I'm going to walk you through. This is directly from the White House's website. And here are some highlights I want to bring you. The order directs the Department of Health and Human Services to take steps to significantly reduce drug prices for American patients. It delivers lower drug prices for Medicare and seniors who rely on it by improving the Medicare drug price negotiation program in order to eclipse the 22% in savings achieved the program's first year, which was last year. Aligning Medicare patients' payments for certain prescription drugs with costs by which hospitals actually acquire them. This is huge. The price hospitals pay for these drugs is what the government wants to pay, which could be 35% lower than what the government actually pays. And then standardizing Medicare payment for prescription drugs such as cancer treatment, regardless of where the patient receives care. Another big one could lower prices by as much as 60%. Another thing I want to highlight, injectable EpiPen for low-income patients and uninsured will be as low as $15 plus a small administrative fee. And then building off programs to help states get much better deals on expensive sickle cell medications in Medicaid that statutorily require a 23% discount. And then the order also increases the availability of generics and biosimilars, which can be as much as 80% cheaper than brand name alternatives. By addressing the influence of middlemen and promoting open competition, President Trump's action aims to create a fairer prescription drug market that lowers costs and ensures accountability across the entire healthcare system. The order also talks about Canada. The Food and Drug Administration sped up development of lower cost generic medicines and biosimilars, as well as creating a pathway for states to import drugs from Canada. And then price transparency rules were developed to allow patients, doctors, and employers to see the actual cost of prescription drugs. And then insulin copays were capped for Medicare beneficiaries. So all these things are in motion to help seniors, particularly, get the best out of Medicare. So let me know your comments in this on this particular topic regarding Medicare. How do you think this is going to change your life and save you money regarding Medicare? Do me a favor and go into the comments and let me know your thoughts about this executive action on Medicare. And now let's talk about the big one, Social Security. So the same day, the president issued an order on Social Security, keeping a promise to ban illegal aliens from Social Security. Let's look at the fact sheet. So today, President Trump signed a presidential memorandum aimed at stopping illegal aliens and other ineligible people from obtaining Social Security benefits. And here are the details. It expands Social Security fraud prosecution program at 50 U.S. state attorney offices and establishes a Medicare and Medicaid fraud prosecution program in 15 U.S. attorney offices. The memorandum requires the Social Security Inspector General to investigate earnings reports of individuals aged 100 or older with mismatched Social Security records. It also directs the Social Security Administration to consider whether to reinstate the use of civil monetary penalties against individuals who engage in Social Security fraud, an effort that has been paused for several years. Another key part of the Social Security executive order is about enforcement. Policing Social Security Act fraud is critical because the Act contains not only traditional Social Security provided to older Americans, but also unemployment insurance, disability insurance, Medicare, Medicaid, TANF, and other programs. It means that the president is going after all these programs regarding fraud, waste, and abuse. Next, let's talk about the Federation of American Immigration Reform that calculated that taxpayers spend about $182 billion annually to cover the costs incurred by the presence of 20 million alien and their children. That's the administration's own language, which includes $66.4 billion in federal expenses plus an additional $115 billion in states. So the states spend more, according to the Trump administration, in costs related to immigrants that are here illegally. So the Congressional Budget Office estimated that the Biden administration's border policy, according to the White House, has cost taxpayers $16.2 billion in income. Now, the border. Already, the administration has stopped more than 1,000 immigrants with criminal record or ties to terrorist activity from receiving Social Security benefit, according to the government executive order that came from President Trump. So I want to let you, I mean, preventing fraud, waste, and abuse has been a central theme from Elon Musk, President Trump. What do you think about this executive order? Do you think it goes far enough in rooting out fraud, abuse, and waste in the Social Security system? I want to hear your thoughts in the comment section below, because this has been an ongoing thing that the administration has been working on, trying to improve Social Security benefits, trying to improve Medicare benefits. Let me hear your thoughts in the comments. And then finally, let's talk about Medicare. Do you know that there's so much activity happening in Medicare that most seniors just get so tired, and in fact, the biggest problem is that it's very difficult to figure out what policy from Medicare perspective is good for you, because there's so many changes that are happening that impact Medicare. For example, this one from California. California tries and fails to fix a major Medicare loophole for seniors. And then people are losing coverage. Sometimes you're on a particular coverage and then the plan drops out of your state, like what is happening in Minnesota. So it's crazy to think that there are 24,000 Medicare plans out there nationwide, and seniors are expected to figure out what policy fits their budget, fits their coverage, their needs, and with so many options and restrictions and costs to consider, How can you pick the right Medicare plan for you? That is why 90% of all seniors are in the wrong Medicare plan. And picking the wrong plan can cost you. On average, $300,000 is spent by the average couple on Medicare during retirement, and it can affect your health. There's nothing worse than needing care and not having it because your plan that you thought covered a particular thing now does not, or that your doctor has been dropped from that network, etc., etc. So, we have a solution, a free solution to you that can help you sort through all the Medicare. So, if you're turning 65 or you're currently on Medicare but need to see if you can get on a better plan, Chapter Medicare, our partner, can help you. These guys are the real deal. Their goal is to make Medicare simple for you to understand, choose, and use your plan. Now, there's a story behind it. One of their founders actually got involved in this because, he watched his parents struggle to navigate the process of choosing a Medicare plan and wind up paying premiums that were hundreds of dollars a month more than they should have paid. So he realized what a terrible experience the whole process was and decided to do something about it. And then another co-founder of Chapter Medicare, is actually one of the highly rated publishers in the Medicare space, has a book on it. It's Not Complicated, by Ari Parker, who is an attorney and a Medicare expert. And this is from him. When I first started my job as a Medicare advisor, I discovered that many seniors are getting misled into buying the wrong plans simply because no one took the time to sit them down and explain what's going on. That is why I came up with the 3Ps method: simple, easy to understand how all this works. And that is what infuses into what they do at Chapter. So there are 3 reasons why we're partnering with them. Number one, the service is free to you and they are unbiased. But here's the kicker: they are the only Medicare advisory company with access to all 24,000 plans. So they can tell you what is in your local area and customize it to what fits your budget, what fits your needs, the coverage you need, the doctor's network you need, the prescription drugs you want, etc. And one of the biggest reasons why we decided to partner with these guys is that their licensed agents, their Medicare advisors, do not work for commission. So when they are working with you on the phone, they are not trying to sell you the most expensive plan to make the best commission. They're there to really help you get into the best plan. Here's how I know. These are the guys you're going to be talking to. This is directly from their website. These are their licensed agents, some of them that I was able to just take a screenshot so that you can see. These are actual people that are going to be helping you with your Medicare needs. And here's the thing: Chapter will show you every Medicare option, including detailed information about which doctors, specialists, prescription drugs, and hospitals that are covered with each plan, what copays and costs, and how the plans compare to traditional Medicare. This is what they're going to do for you for free and help you get into the best plan. And so you may not have a lot of time. You may have a short window. If you're turning 65, you have 3 months before your birthday and 3 months after your 65th birthday to make a selection. These guys can help you do that. Call the number on the screen, 539-205-2147. Or if you prefer, go to askchapter.org/insider that I've put on the screen. Fill out a short form or go into the description of this video. I'll also include the link there. You can click on it, fill it out, and they'll reach out to you. But don't delay. There may be a short window for you to change into a better plan and avoid being one of the 90% of seniors that are in the wrong Medicare plan. These guys are highly rated, A+ rating with the Better Business Bureau, lots of 5-star reviews online. And did I mention they can save you $1,100 a year on Medicare? It's a no-brainer. Call Chapter and let them know that Benefits Insider sent you to them. So if you are looking for a way to stay on top of all the changes that are happening, there's so much happening. This week alone, there were 2 executive orders on Social Security, on Medicare, and other things. There's so much going on that can impact your benefits. And so we've created a newsletter. Go to benefitsinsider.co/subscribe. Very simple. And then sign up for our newsletter. It's free. But what it will do is it will keep you updated on the latest news and updates, anything in and out of Congress that's going to affect your Social Security, Medicare, Medicaid, food stamps, and other personal finance issues that seniors should be aware of. We want to bring it to you, all the breaking news. Sign up for our newsletter and stay informed. So that's all I want to bring you today. I hope that it was helpful to you. If you like what you heard, hit the like button, hit the subscribe button, and I'll see you in the next video, which will be tomorrow. Have a good night.